his arteries were similar to those of a man 20 years older, a man 72. And he was shocked when I told him that. You are 52 years old, but your arteries may be 72 years old. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Now, when I tell patients this story, they're always shocked. I had a patient who's 52 years old, comes in as a new patient, hasn't been to a doctor for a couple of years, was previously with another doctor who had been giving him a blood pressure pill and he had been taking it, felt like he didn't need to see a doctor right away, but eventually made his way to a physical with me as a new patient. So we ran a test called a cardiovascular profiler, and turns out that he had abnormal arterial elasticity, and I'll tell you what that means in a few seconds. And the test estimated that his arteries were similar to those of a man 20 years older, a man 72. And he was shocked when I told him that. And first, he told me no one had ever done that test before. And secondly, how can that be? And so this is where we had to get into the science of arterial elasticity. So this machine is called a cardiovascular profiler, and it measures something called a pulse wave velocity. Now, this is, without getting into the weeds of physics, it is a test basically that checks the elasticity of your arteries. So when we are all born and as we age, our arteries lose elasticity. Now, what does elasticity actually mean, you ask? I'm glad you asked, because arteries are supposed to be very flexible. You want to view your arteries like a garden hose, right? When you have a garden hose, it's brand new, it's very elastic, very flexible. Water goes in very well and no problems. What happens when the garden hose sits out in the sun? You leave it there through winter, through spring, it's out in the garden. It becomes stiffer over time, right? Becomes harder. It loses that elasticity, that flexibility, and same goes for your arteries. Remember that the arteries, are made up of something called smooth muscle in the artery walls, right? And this is supposed to allow the arteries to expand when blood comes in, contract when blood leaves, expands, contract, expand, contract. This happens throughout our lives. But what can go wrong? High blood pressure, smoking, lack of exercise, obesity, diabetes. These are all things that can change the elasticity of the arteries. And so what happens is a patient can come in, their labs are normal, cholesterol is normal, diabetes is not apparent on the labs, but they have hardening of the arteries. Why? Because over time, these arteries take a beating from blood flowing through them. So this is a test that gives you additional information on top of what we already have. Now, we run this test annually, new patients and during annual physicals, because this is a good test for screening for things in addition to high blood pressure control, cholesterol, and age. So how is this performed? It is not an invasive procedure. It is done using a sensor that goes on the pulse, on your radial pulse. And then the machine does the calculations and then gives us a result. And when that report comes out, this is a good time for a patient to sit down with the doctor and look at their overall risk, because it is reported as either normal arterial elasticity, borderline, or abnormal. And it looks at the large arteries of the body, for instance, your thoracic aorta, your subclavian arteries, the carotid arteries, and then the smaller arteries of the body, the ones that go inside your organs and which are usually more prone to cause problems. Problems like heart disease, strokes, peripheral artery disease that eventually leads to amputations and the like. So, when we get these results, this is another great moment for patient-physician allyship, because then we sit down and say, all right, you're 52, your arteries look like those of a 72-year-old man. What are we going to do about it? Number one, we're going to screen, find, and treat high blood pressure if it does exist. Number two, we are going to institute regular exercise because cardiovascular activity is shown to improve arterial elasticity. And number three, we're going to make sure that you are aware of this risk because, remember, arterial elasticity changes are an even better predictor of future risk of heart disease in younger patients, that is, patients less than 60. And so the younger you are, the better off we are testing to make sure that we get ahead of things. Because if you remember, I have always said that the benefit of primary care is not in fixing things that are broken. It's in looking around the corner to make sure that nothing is coming that is going to break you down. That is the power of primary care. It's in preventive medicine. Because let's face it, when you have a heart attack, you need to see a specialist, cardiologist. But to prevent a heart attack, you have to see a primary care doctor. Because the work in preventing a heart attack starts decades earlier with things like measuring of cholesterol, checking blood pressure, cardiovascular profilers, echocardiograms to look at LVH, and all these things. It is the dirty work that is done by primary care doctors, unsung heroes of the medical system, that prevents problems later. So, if there's anything for you to take from this episode today, make sure at your next visit to ask if you've had a cardiovascular profiler. If your doctor does not do the test, ask him who does. And if he doesn't know, come see us. We'll be happy to do it for you. All right, on this note, I will leave you with this today. I will see you next episode because the fight doesn't stop here. It must go on for optimal health care. See you next episode. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Taken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.